And so this round will be a little bit different, but before we start, I'd just like to say that Queen's University is situated on the traditional Anishinaabe and Haudenosaunee territory, and it's important to acknowledge that this territory is significant to Indigenous peoples who live and are living on this land. It falls to us to reflect meaningfully and respectfully about our individual and collective roles as stewards of our land. And I was fortunate enough this summer to be on a week-long canoe trip, and it gave me some time to reflect on just how grateful I am to be able to live and learn on this land. And I'm sure there's been times when you've been in places that you were able to reflect on that as well. I'd also like to mention that as scholars and researchers, it's important that we respect the right of Indigenous data ownership and ensure that we are committed to an ongoing process of collaboration, growth, and learning. And we have nothing to disclose. So today, as I mentioned, this education round is a little different than what you're normally used to. The purpose of this is to connect with others in this scholarship space and to talk about the needs of the Queen's Faculty Health Science and staff interested in educational research scholarship in a community of practice, and to identify how to improve and strengthen our community of practice. So we'll go through some introductions. There's a few speakers today. We'll talk about the results of a needs assessment that we completed in the Faculty of Health Science with in late 2024, early 2025. And we'll have a discussion on how to build and grow this community of practice. So the facilitators are part of the Office of Professional Development and Educational Scholarship, OPDES, Ed Scholarship Advisory Committee. And we have a few of them here today that will be presenting some of what we're doing. And I'll pass it over to Kim.
Thanks. Hi, everyone. I'm Kim Sears. I'm a professor in the School of Nursing, and I get to work with the OPDES group, and a lot of my work is interprofessional, so it's really nice to meet everyone.
Hi, I'm Amanda Ross-White, and I'm from the library, and I'm pleased to see everybody here in person as well as see those online.
I'll do Heather, and Forrest will do you.
Hello, everyone. My name is Heather. I'm Associate Director of Scholarship and Simulation Education with OPDES.
Thanks, Nancy. Hi, everyone. My name is Boris. I'm Associate Professor in the Department of Surgery in the School of Medicine and a Medical Education Scholar supported by CIMO. Sorry I couldn't be there in person.
And hi, everyone. I'm Natalie McGuire. I'm an Education Developer in OPDES.
And I think everyone knows me. And
hi, everyone. I'm Karen Richardson, and I work at the OPDES team.
Very important to this, these rounds. Okay, I think we were going to do participant introductions. I think probably most people know each other, so I don't think we need to go through. Is there any? Actually, maybe Emily might need to introduce herself.
Hi, everyone. My name's Emily. I'm a second-year medical student. I worked at OPDES over the summer as an intern, so I kind of developed an interest in health education from there, and I'm super excited to be here this morning. It's nice to meet you all.
Is there anyone else that doesn't know anyone? I think we're all good. Laura, Alan. Okay. Okay, so I think we will start, and I'm going to pass it over to Boris.
Thank you, Nancy. Nancy, can you tell me how many people are there roughly? Because I can't see, obviously. Like, are we 14? Okay, great.
Including
Fantastic. Thanks everyone for coming out. That's really great. So as Nancy mentioned, what we were trying to understand is how we can support the faculty at Queen's Health Sciences better with regards to educational scholarship and interprofessional collaboration. And we conducted a needs assessment that was done in late 2024, early 2025. And you can see here we had approximately 30 individuals who responded. There is a pretty good distribution across different schools, from School of Rehabilitation Therapy, from nursing, from School of Medicine, both from clinicians and non-clinical departments. And if we can go on. And some of the important questions that we asked is we wanted to get a sense whether individuals felt that they're presently part of a health education research and scholarship interprofessional community. And you can see here that approximately 2/3 responded yes, however, a third responded no. And for those individuals who don't feel like they're part of the community, we asked whether or not they would be interested to become part of such a community. And overwhelmingly, you can see over 90% of individuals were being supportive. So that was a good marker of the fact that we really need to look at strategies and ways of getting people together. And these rounds are one of these strategies. We'll go on to the next slide, please. And when we asked individuals why they're interested in the community of practice, they've mentioned kind of the four major themes, one being collaboration, the second being networking, learning from others, and improving the current system that we have. And I have a couple of quotes to share from individuals. One quote is, "I don't feel that we have a community of practice. I suspect there are other people researching and interested in the same areas as I am that I don't know about. It would be great to collaborate with them." So I think this speaks to the fact that we have still some of the silos where individuals within different departments or different schools are doing similar type of work, but we may not be aware. The second quote is that we're siloed in the work that we do, and sometimes we don't hear about the great work that others are doing. I would love opportunities to bounce ideas off others, ask questions, and find like-minded research scholarship collaborators. Another quote is, individuals are interested in learning from peers about clinical evaluation and competency-based education. They want to collaborate and do collaborative research in that area. And another individual mentioned that they're already doing work and collaborating with wonderful people at OpDes, but they'd like to expand their network. And when we asked individuals if they're not interested, in being a part of a community of practice, what the reasons are, and really overwhelmingly, the reason was lack of time. So they're interested, but unfortunately, due to their clinical commitments, they're not able to do it. I'll pass it over to Kim.
Great. Thanks, Boris. The next question we asked were the barriers and challenges to being part of the QHS Health Education Research Scholarship Interprofessional Community of Practice. And what we heard there were some of the barriers were time. People felt they couldn't get the availability, and scheduling was a trouble that came because some people are working first thing in the morning, some people are working late in the day, and it just was a challenge. Another thing was resources. There was little help. People were working flat out with their own projects, and we're looking for what resources were available for them here. Communications, messages received are geared towards your own profession. So people are getting a lot of emails about maybe the School of Medicine if they work in medicine, but they weren't getting a lot of information about other schools. Lack of connection and networking opportunities. People said that they didn't even know who to connect with and who was doing work in this area, and they didn't feel there was much opportunity for that. There was lack of knowledge and a lack of awareness about, again, who to ask, who is interested in similar projects. And there was silos. The system was designed to reward for being PIs, were some of the messaging that came along. So if you weren't leading projects, you weren't really getting rewarded. But there is opportunities when we look at this. I was thinking about this as I was reading some of the barriers. How we've gotten around this when we've done work with our teams is really rotating the PI. So you're the PI on this project, but next time I'll lead. And that way we can all work together. What would you like for in a QHS health education scholarship interprofessional community? One thing that came through was connections and collaborations. And people said that they would like meaningful connections and they would like opportunities to lead and to work in research opportunities with other like colleagues across the schools. Sharing, so knowing where to share your work. So if you're doing work in this area, where were opportunities to share the work that was going on? What journals would work? What opportunities were there to show posters and network? Support, assistance with scheduling came up again. People are trying to balance their own schedules and, you know, it's very hard. Place to connect and share. Relevance to the field. So how is it relevant to your own field and then beyond your own field? Specific topics. So people were interested in professional education, CPD, medical education. IPCOPs presently involved in. Some people said I'm involved, a CMAE member. I'm an MHPE candidate and consider my cohort supervisors a community practice. REACH came through, WHEC partnerships. Building capacity and evaluating competency-based education implementation in physiotherapy at Queen's. And I was even just thinking of myself. I'm involved with the World Health Organization and many different universities around the world. So I think, you know, together we would have a great collective internationally to bridge people and to make connections for us around the world, which would be really cool. What do you find meaningful about being a part of a health education research scholarship interprofessional community, if anything? People said things that they felt really important and meaningful were the collaborations with others in health education field, and sharing resources was one of the points that came through there. The networks, people really liked the networks across the different disciplines, which I think is so meaningful. The IPE was essential focus in all professional training across for future healthy collaborations and resources. So sharing resources and how can we make our work better but lighter if we can share across. So I think that was some of the important points that came through. And now I will share it to Amanda.
Good morning. So I have my little security blanket here, which is kind of interesting because I think one of the first things that really came out of this next part about what those suggestions are for those health is the importance of meeting in person. And that's something that is great and surprising. A lot of it, the comments were around things like make the connections for us, help to build those bridges, comments like we need to know who does what, and that communities exist to help connect people. So I think that's something, that first point there is really great to see that we're going to hopefully have some regular meetings in person, also booking them in advance so people have enough time to prepare. And another great quote was about engaging the interested parties beyond the 4 clinical programs. So there's a lot of programs that may feel a little disconnected from this work, and so bringing them into it. And obviously as the librarian, that's like going to be a little bit thing that hits me hard. Interprofessional education, certainly something that we need to work on as well, trying to work together at the beginning of an idea around IPE and not sort of try to fit the IPE component in after the fact. And so that this community would be able to help with some of that. Support, hopefully they're looking for some partial financial support from QHS and benefit to the schools for doing this kind of work. So that's another one that they're hoping to see. And another good one is looking for models that exist in other places. So let's take a look and see what they're doing at Western or at Toronto or at UBC or some of these other places that have some great IP or COP practices around educational scholarship. So next slide. There we go. So some of the recommendations for activities or events. Research days, social activities. I think that's a lot of fun if we could do some social things. Some definitely multidisciplinary network to share our interests and share what sort of things we're working on right now. Help to get some things like that. Ideas like workshops, panel discussions, journal clubs. Again, that's the librarian and me going, yay, journal clubs. No one else gets excited about this. So an annual education research day was another suggestion that was pretty interesting. A lot focused on things like social stuff. I think that's a really interesting perspective, that we need some more social activities and things like that that get us talking with one another and building those connections and bridges. People need to see the value. Of course, that's certainly true. If they see value in this, they're going to want to come again and again. And that was a great suggestion as well. So next we have, how could a QHS educational research scholarship community help you in reaching your educational research and scholarship goals? So some of the comments about that were exactly, it's often a catalyst for future projects and grants, ideas to spark some new interprofessional education collaborations. They want to connect with like-minded scholars who are interested in studying similar things, or have expertise in an area where I am lacking, which I think is a great one, and the benefit of teamwork. Learning about different places for scholarly output, so conferences, journals for publishing in, that sort of thing. Help identify champions or supporters for the work, and so on like that. And already some people said, I'm already very engaged, and you've already been very helpful, which is always great to see that we're already doing some of this work as well. So additional feedback, there's a few things that we want to sort of make sure everybody saw. Please start this community of practice. I love that. I'm excited to see what comes of it. Also great. And I swear it wasn't me who said that. Question look at from the perspective of the individual schools and individual faculty members, which is great too. A good comment, that one. And as always, funding for everything. So Heather, you're next up.
Okay, so now time for some audience participation. So people online, feel free to add into the chat. We'll monitor it. And then in the room as well, feel free to raise your hand and just share. So we want to hear from you. How do we build this community? What are some ideas that people have? Yes, Terry. I know better than to give you the microphone. No.
My voice is sufficiently loud, but for the folks online, I think one of the things that we have to do is you have to catch lightning in a bottle with the topics that you are selecting. Pick the trending topics of the day. Speak to the issues that people could very well be having within their own teaching, within their own learning, within their own scholastics. Focus on those issues. I think we'll find ourselves with a building audience.
Karen, anything in the chat yet? Wonderful. Yeah. So documenting what's already underway. Yes. I'm going to, sorry. Just for online people.
This has already been mentioned, but a research showcase is not just a great idea about who's doing what, but you add in little canapes and drinks and social. And so I think like the combination of everyone getting together in person and showcasing, and then you can say, I presented here, this is doesn't have to be novel work. It's where you've been showcasing Queens around and what you've been doing. And I think that that would be a great start.
Yeah, that's a great idea.
They're talking about food. I think one of the important aspects, a couple of important aspects. One is to remember, we love the word IPE. We love the acronym IPE. We have to remember that Queen's Health Sciences has many disciplines beyond the professional disciplines. And so we have to think broadly about those disciplines. And I think you'll likely see over the next little while, as things evolve, more and more teaching intensive faculty who are part of our community. And those people are going to need a home for their scholarship, for what they do. And so we need to figure out how to engage that bigger community of faculty in this work and give them a home. And so I think that's very important to remember that and to speak more about interdisciplinary work rather than interprofessional work. I know the professions are kind of often seen as a cornerstone of our faculty, but we're much broader than that, and we're a huge community. Similarly, I think remembering the people who are not full-time and who float around out there, who are our teachers, our preceptors, our other community of people who perhaps, also are looking for opportunities to be valued and to do work. And so how we can engage them. I'm not saying that I have a bag of money to engage them with, but if you can figure out other ways to engage them, I think that's really very important. And I can't remember what the last one was. I had this really incredible thought, and it has completely left. So I'm giving you back the mic, Heather.
Thank you. Sorry, just some transition time for online people. I don't think you can see us running there.
So something I've had on my back burner for a really long time, and I'd love to hear people's thoughts about, is not a journal club. In fact, very intentionally not journals, but rather children's books. I went to a great presentation by a woman who calls herself the Readiatrician. And she has a program where they read children's books about health topics and talk about how to, better see diabetes or whatever the topic might be, eating disorders, etc., from the eyes of children, and using books as a way to do that. So I think that's a great way for us to think about engaging, for example, with our teacher colleagues over at the Faculty of Education and bringing that in to have a conversation around different health topics from a children's perspective or a teen's perspective or something like that. And it's also a lot less intimidating than a journal article to read a children's book. So anyway, that's one of my ideas, and I think that would be fun.
Just to follow up on what Amanda just said, and goes to something that was said earlier as well in terms of a list of projects and people knowing what's going on, we have an ongoing community of students, medical students, who their group is called Reads for Peds, that they write these books. They write a number of children's, but they tackle different topics every year. And that's been going on for, I date everything by the pandemic, at least 5 years before the pandemic. So we've got, so there's a tie in there. But again, some people in this room didn't know that existed until this moment. So there's that. And the other, well, I have the cube. In terms of building the community, some of it was touched on in the needs assessment, is the time element. And I know for myself as an educational developer for the School of Medicine, there's things that sometimes it's like, this would be useful for long-term what I'm doing, but doesn't, like, can I afford the time right now? Can I justify the time right now? So I'm wondering if other people are in that headspace too. It's like, this would be a long-term thing, but right now I should really be helping doing this or writing this report and that kind of stuff. So time.
The other thing that might be nice is getting everyone together to try and brainstorm some research ideas too. And, it's really nice having these groups that are all from different disciplines. I'm trying to think of Richard's wording, not say professions, but from different disciplines and backgrounds and education, and everybody bring them together. And then when there's calls for different things, we have a team ready to go, because, we could do some nice scoping reviews on education pieces, cross disciplines, and get our team ready so that when big calls come, we're ready to go. We're already operational.
Proactive. I don't trust myself to throw the cube without coffee.
So one of the things, this is unfortunately not like, here's how to do it. Here's one of the struggles I have, is that to get some of the supports like from OpDes and stuff, is you actually have to have funds to come in. So I found lots of times where I'm like, I would like support, but I have no money. I'm really just doing it all out of my own time. So trying to find, like, I don't know, some money somewhere that could allow some supports that don't require even within ourselves to pay for it.
Great points. Any other thoughts? I think we're all up to date with online, right, Karen? I just want to double. Yep. Okay. Came back to you.
The other important aspect I think to remember is if you read what came out from the principal yesterday, the bicentennial vision, which essentially looks a lot like a strategic plan. The principal speaks, and I have to read it a few more times. I'm one of those people who has to read everything 5 times to really digest it. But but we're hearing this within our own faculty. I think you see it in that document, the idea that research is going to be more seen as something that we establish clusters of strength. And if educational research and scholarship wants to be seen in that, it's going to have to figure out a way to develop a cluster of strength that has the same prominence, I would say, as other areas. And that, to me, is going to require people to work together on common goals, common projects, big picture ideas. Otherwise, it will just continue to float around as this kind of fringe thing and not really become a mainstream area of scholarship and investment.
Any other thoughts or ideas from people?
Thanks for all of these. I just wanted to follow up, Richard, on what you had said earlier about it's a much bigger than the 3 schools. And I was just wondering if you had any ideas about how that could happen for that outreach.
No. We do only have 3 schools. I think it's important to remember, though, that a very big part of the School of Medicine includes a very large department that's not one of the professional disciplines. It's biomedical molecular sciences. We have public health sciences. We have other departments. So it's important, and even within the other 2 schools, there are people who are not necessarily tied specifically to a profession, but rather have another role within the school. So, it's ideas. I mean, it's like everything you said. There's a lot of groundwork and engagement work, and that takes time. I don't know that I have the solution. That's what you're all here for.
Sorry, I saw two.
Cluster options that we happen to have, and that's the one that caught my attention. I think that we have to think more broadly than just working within the Faculty of Health Sciences. I think we should be thinking about partnering with the other faculties on campus, the other 92% of campus by student number. I would say that if we are thinking about the faculty who are here, there are natural collaborations with engineering we could be thinking about. There's a whole lot of really interesting stuff that's happening in mechatronics and AI right now that has immediate relevance here in health sciences in terms of the next generation of prosthetics, in terms of assistive devices, in terms of new readability and ways of understanding how the body moves, how the body functions. I think these are the kinds of collaborations that we should be focused on stoking. If we do these, the education scholarship will come as we continue to teach about it. The scholarship will come along from these naturally. I think it's that research begets scholarship as opposed to scholarship can also beget research in terms of the conversation. But I think we have to be considering the opportunity of burning this candle from both ends.
Greek minds think alike, but that was what I wanted to sort of add as well, because there's the other, when you look at the rest of the university, we are very siloed, right? And so we can think about so many different connections. Like I immediately go to the arts and sciences. We're not connected very well. We're going to lose arts and sciences. We need to, to bring them into the fold. How do we collaborate better in delivery of curriculum, let alone educational scholarship? And so I think this group can start thinking about a lot of those cross pollinations, but when you do that, there's always the risk of getting too dilute. And what do you start with? And then there's things that are just aren't relevant to specific population. So you just have to be very careful about how you do that, and that you're doing it in a focused way for the right community, and then doing something else in a focused way for the right community. So everybody can't do everything. And so I just think as we're talking about this, you can start saying and, which is wonderful, but you just have to be not stop any of the ands, but how do you do that in a strategic way, in a focused way where it makes sense, in a broad way where it makes sense.
All great.
We have a comment. Oh, we have a comment in the chat as well from Jennifer. Similar idea, looking at SKHS, business, engineering, education, sociology. It would be great to build meaningful collaborations.
Okay, so I think just in the interest of time, we'll move on, and I'm going to hand it over to Boris to chat about this initiative.
Great, thanks, Heather. So this is a very nice, I think all of the things that were discussed in some way, this hopefully will address. So I wanted to share an exciting initiative that we've been working on, or started working on this year. And I need to acknowledge Dr. Van Wylik, who's in the audience with you, as well as Professor Stockley, for actually being able to secure funding from CMO to establish an Institute for Medical Education scholarship. And the goal of this institute is really going to be to support and advance and disseminate scholarship in medical education by fostering interdisciplinary collaboration, faculty development, and educational research. So I think, the comments about we have great ideas, but we don't have funding to actually approach OpDes, or how do we bring individuals from different disciplines together, or even cross-faculty collaboration. Hopefully this will at least give us a venue of giving an academic home for some of the individuals, and also some opportunities for this collaboration. The rough goals for IMES at this point is to provide methodological support for scholarship in medical education, help support scholarly dissemination, as well as create capacity building programs so we can look at early career educators and researchers and help them thrive and foster within Queen's Health Sciences. So I'm hoping that over the next 3 years, this will become a self-sustaining initiative, but I think this will address some of the things that were discussed. Thank you.
Okay, great. Thank you. And similarly, we are equally grateful to Dr. Stockley and Van Wylik for securing more funding from CMO. Similarly, this is also a 3-year initiative, but this one's focused on reimagining our clinical simulation center. So our objectives, we want to ensure that we're modernizing our simulation approaches really across the spectrum of fidelity, developing, identifying, and integrating leading edge technologies. We also want to make sure that we're utilizing AI-driven simulations and meaningfully integrating artificial intelligence. We hope to develop a hybrid training program, creating a blend of hospital-based and, again, thinking also about classroom-based training. And then, of course, ensuring that we're implementing best practices, so adopting evidence-based simulation education practices to really enhance learning outcomes. So for this initiative, we anticipate the benefits will be the following: enhance training quality, attracting talent and funding, improve patient safety, and interprofessional collaboration. So more to come on those for sure. Okay, so some more audience participation. We'd love to hear from you regarding what you'd like to hear from some of the upcoming rounds. The next one's already been decided, but after that, I think it's open. So if you'd like to scan this QR code, Natalie's got the results here.
Got one more comment in the chat. So Roger Peelan says to everyone, could we consider broader, more inclusive language, such as Institute for Health Sciences Education versus Institute for Medical Education?
So Roger has a great comment, and not to put Richard on the spot, but we can either talk about it later, or Richard, if you want to comment.
Roger, you and I can talk a little bit more about this later. Some of this has to do with the fact that that's a CMO funded initiative, and the source of CMO funding somewhat dictated how we had to label this. But I do believe, although that's the title of that specific initiative, it will have benefits that go well beyond medical education.
Thank you, Richard.
Okay, we'll just give people a minute to scan here, and then we'll see what you're wanting to hear about.
Is the institute going to be anywhere? Like, is it's just a name kind of place? Yeah, because it would just, I think of OpDes, like I go there, not every day, but I go there often. It's got lots of refreshments up there compared to art school, so it's good. But like, it'd just be really nice to have a place that people could go. I'm just thinking about that. Yeah. Okay, that's good to know.
I'm not sure if everyone online heard that, so I'll just repeat. It's more like a virtual institute, but it also will be closely connected and embedded within OpDes. So, okay. The Resnick scholars are presenting. Yeah, but I think we have a slide at the end that'll give you more detail. It's very exciting. I'm looking forward to it. So, any ideas? Oh, it's the way. Yeah, so AI is popping up, reviews, some recommendations, I think, to have Dr. Gaudry chat about conducting reviews. Yeah. Future opportunities, teaching. Yeah, it is. I'll give people another minute here. Get some great ideas. And if we don't capture them today, you can always reach out. Who should they reach out to Nancy if you have other topics that you weren't able to add in? And I wonder who added AI. Yeah, there's no conflict of interest here. Okay. Oh, I didn't see that. Yeah. Pedagogy. Yeah. Okay. We think we're well. Yeah. Well, okay. So some of the most common ones: AI, simulation, reviews. Maybe having Dr. Gaudry come in and talk about different reviews, thinking about teaching different opportunities within QHS specific to EdSchool. And I think that's a lot of it. Oh, pedagogy, yes. And then feel free to add more in the chat. We can always capture that later as well. Okay, so another burning question we've been having, and although this was based off the initial needs assessment where they said people would like to have the same time to have it into their schedules in the same day, we do want to ensure that we're meeting people's needs. So if you could also indicate whether or not this time works for you, or if you have any conflicts, if you can please just indicate. Yes. Yeah. Yeah, great point. So some conflicts with medicine grand rounds. Yeah. So if not Thursday, are there other days of the week that people would prefer? Again, recognizing that if you're not here, we're not able to ask.
It might not be just that it's, oh no, it can't be on Thursday. It can't be the same Thursday that medicine's having their grand rounds. I know that it's not, it's every week. Is it every week? Well, I don't think we're having them in the summer, so I do think we are going to have to pick another day if we wanted to avoid that conflict. I didn't realize it was every Thursday.
Don't do Monday because some of us will forget. Not, asking for a friend.
We heard mornings are good, but day of the week is tough to. I think OB-GYN, I know every department will have their teaching rounds in the morning. So I know Ashley has said that OB-GYN has them Wednesday and Thursday. We won't catch everyone. And I know you've said preference to keep it the same day opposed to switching. Thoughts on that?
The last needs assessment was done in 2018. And at that point, we were picking different days to try and accommodate people. And the overwhelming response was the same day, same time, so that people could just put it in their schedule and it would be there. So I think we would probably keep to that. But the day.
So it sounds like maybe Tuesday or Wednesdays at this point are better. But okay, we will check our
One comment here. Boris says same day, please.
Well, thank you everyone for all of your feedback. I'm going to pass it over to Natalie.
One more QR code or link. I'm so sorry. If you have a chance to do an evaluation, that would be very helpful to go over, how it went today, what we could fix up, switch up for next time. As we're just starting these today, we do really welcome any feedback via the form. It's also, I believe Terry wants to speak to an accredited event, but I don't know if you want to speak to that. You can claim a certificate from being here today if you fill out the form. So those online or here, fill it out, please. I'll leave that up for a moment. Maybe, Karen, could you copy the link in the chat? I don't know if that's possible for people to, just the link on the screen, if it's possible. We can also send it out after to folks if, as a little thank you for coming and reminder to get your credit. As you're filling that out, a reminder, this is our next session. So it's on Thursday, November 20th. And the topic will be the Resnick Scholars. So we're really excited to have 3 Resnick Scholars. Kim, who's here today, will be presenting again, as well as Marion and Wiley. So they'll be presenting on their Resnick Scholar work. We'll also be doing a little bit of an overview on what the program is, how you can get involved, what they do, and then they'll go over and highlight their topics, which include development of an international health quality certificate from Kim, online resources for reducing racial microaggressions in classroom and clinical teaching by Marion, and interprofessional education cross-program curriculum mapping by Wiley. So we're really excited about that. And then following the November session, there will not be one in December, but we will come back in January, and stay tuned on that topic. We'll probably take all the ideas from today and the notes that you've given us and come up with something really exciting. More things in the chat. Perfect.
Yeah, we have a comment from Alan Grill. Is this Maine Pro accredited for family docs?
Yes, it is.
The answer is yes.
Would it be helpful to folks, I guess, to send out a reminder with maybe the evaluation link and reminder for a future session? Yeah. Okay. And what time is it? 10 minutes left. Nancy, if you want to steal the mic for any reason.
Are there any other final comments? The discussions today have been very helpful for future sessions. Nicholas?
Not to take everyone back, but I was just thinking that perhaps in terms of, involving people from other disciplines and what have you, if we can carefully search and identify faculty members or researchers that are also involved in educational research, elsewhere located in other department, and intentionally invite them to even, do presentations and learn more about them, they may feel, a little bit, excited about, joining us, something like that.
Great suggestion. Thank you. Any other comments? Okay. I'm going to pass it over to Terry.
It's not a faculty development or CPD program without a couple of prizes. So for the first 5 that were here, I'm going to walk around and I'm going to hand you a hat filled with goodies. This is a hat that will mark you as an influencer on campus. You will be known far and wide. I will now pass it back to Nancy as I passive aggressively hand out these hats.
Thank you everyone for coming. Those of you that are online and in person, we do really appreciate it. And we're really looking forward to the next one. And have a really good day. And we'll see you in a couple of months. Thank you.